In Seattle, scientists have been working on cell therapies that have the potential to transform how we can treat certain blood cancers. And these are among over 500 emerging medicines for all kinds of blood disorders, from hemophilia to lymphoma.
We take a look at the unmet medical needs in the communities, and we think about the strategies to address those unmet needs.
And one thing is certain.
We absolutely need more therapies for blood disorders.
Terry and Justine have been researching cell therapies for blood cancers like lymphoma and multiple myeloma. And these work differently than other treatments like chemotherapy.
We actually modify a patient's own immune cells and infuse them back into the patient. So it's actually a one-time infusion.
It's a really exciting change from the standard of care therapies, which tend to be repeated cycles of chemotherapy or other drugs that the patient has to continue for a long time. And cellular therapies have been shown to be very effective at treating blood cancers.
Blood cancers will make up 10% of all cancer diagnoses.
Cell therapies offer a lot of promise for the future. We have a very large data set, and we're taking these learnings and applying them back into our pipeline for next generation approaches.
These next generation cell therapies are promising.
We can develop potentially these off-the-shelf approaches that can be accessed by more patients with blood disorders across the globe.
And there's also the possibility of extending these therapies to solid tumors.
One of the things that the pharma industry does really well is put a lot of resources behind drug development.
Novel therapies for patients with blood disorders is critically important because most patients often won't respond to or will relapse after their initial treatment.
Fortunately, more are in development.
These areas have progressed with huge leaps in technology and innovation, and I expect that will continue such that we should be able to make progress more quickly than we have in the past in the future.